Hello, everyone. Welcome to season one, podcast two of Uncommon Stories of Common People. So, today we have with us Mrs. Gulshan Kavarana. The life that is far extended beyond the situations that were gifted, beyond the situations that were presented to her. This woman talks about her journey of support group for people with the children of special needs and adults of special needs. I'm trusting that everyone will have one message to carry from this and you will enjoy this. Thank you. So, hello everyone. Today we have with us on Uncommon Stories of Common People, Mrs. Gulshan Kavarana. If I date back to how I know Gulshan, it's been 16 or 17 years, right? I met Gulshan first as a mum of a special needs child, Zara. Today, Zara is a blessed adult, and we still continue to keep in touch. I still see Zara because of the confidence that the family has shown in me, the trust that they have shown in me, and I'm in 100% gratitude for that. If I have to elaborate on what Mrs. Kavarana, what Gulshan Kavarana is all about, it's a lot that I can talk about, and you know it. So, for our listeners to know, I would say that when Zara was born, it was an intense detour, an intense turn in your life. But you know, there are very few people who grow their life around the detours. There are very few people who are able to build up the strength. And you did it not only for your family, you did it for several families around, several of them that might be having the similar need, similar environment. And today, Gulshan is a symbol of the support system, a very special group that you run that is a special needs support for the families. And not only that, Gulshan is also mentoring adults, one of whom has become a brand in UAE because this boy is now an adult who is also catering with the paintings and is doing such a marvelous job. But obviously, not because he was just, it's a gift, it's also because there was a great mentor behind him. So, Gulshan, there's a lot that I can continue to talk about you, but most importantly, what would you like to share as your journey in Dubai? How did your life bring you here?
So first of all, thank you, Imneet, for having me here and
My
for
pleasure.
letting me share my story. So I came to Dubai with my family, my husband and my older daughter, Janai. My husband got a job here, so we moved here, and I was pregnant with my second daughter. And something was telling me that this baby is not going to be normal. So
Wow.
I don't know, it was just this fear. And so I used to pray in those days, and I said, okay, you know what, just give me a normal child and I'll work with people with disabilities for the rest of my life.
This was before Zara was born.
Yes.
Wow.
So when Zara was born, she was absolutely fine and normal. And so I called up all the schools for children with special needs and I said, can I come there as a volunteer? And, you know, I started volunteering there. And never in my wildest dreams did I imagine that one day my own child would be a student in the school. And yeah, after 4 months, I gave Zara just a routine vaccine, the DPT vaccine.
Right.
And 16 hours after the shot, she had her first seizure. And it was, I mean, our lives just turned,
Of course. Yeah.
And we were in this deep despair, like, what do we do? How is our life ever going to improve?
to
Or
same.
what can we do? Because then Zara started getting photosensitive, so we couldn't take her out in the daytime, and we had to make her wear glasses even in the house. Any kind of light would cause a seizure for her, and it was really a big struggle. And all my family around me was trying to support, not in Dubai, but they were in India. They were all trying to support, but they would tell me, we know what you're going through. And I would say, no, you don't. You don't have a child with special needs. You don't know what I'm going through. So then I said the best way to do that is talk to other families who
Yes,
have children
yeah.
with special needs. So that's when SFS started, in my living room with just 6 families.
Wow. So that's the origin of such a huge group.
Yeah.
That's, I mean, today I'm sure that SFS is known to people. SFS has been awarded several times, and it's a great work that you have done, especially to bring awareness. Like, as you said, that Zara is 24, so that means 24 years,
26.
26 years back, we did not have Google. We didn't have access to any information. So at that stage, to reach out to people, I'm sure it was not as easy as it is today.
Even now, like this evening, I have a family coming to talk to me because they have an 18-year-old son on the autism spectrum.
Right.
And internet is there, Google is there.
Right.
But they still want to talk to me because they want to find out from a parent, like what is the best thing, what can we do for our child, So even though it's all there now, we still want to talk to other families who are in the similar situation.
I mean, I understand that because I feel that only those who have walked the path before you are they are the only ones who can share the first-hand experience. Everything else is two-dimensional,
Exactly.
and two-dimensional doesn't apply in life. So yeah. I've chosen few questions for you, Gulshan. I will not go into difficult ones. One thing that I've seen about Zara is that she's been, by God's grace, the longest survivor of Dravet syndrome in India, right? And I have seen her, like you guys are so consistent with your appointments. I have never seen that you missed even one. If I tell you come back in 3 months, I need to see her quick, you're there. So that much consistency, that much diligence. And I'm sure that you do know that every time I'll comment that I'm so impressed with the way you're doing things. I'm so impressed with the way you're carrying on this. So was it a deeper commitment, or was it something that changed your mindset? Especially I can imagine that people go very regular with the medical help, but you've been so consistent even with the dental help. So was it something that you witnessed any time in life, or was it just that you decided that, okay, no?
So when about 16, 17 years back, before we saw you, Zara had developed tartar in her teeth.
Right.
It was very visible.
Right.
We could see it. So we went to about 5 different dentists in Dubai and in India. And we kept begging them that, can you just remove this tartar? And they said, no, don't worry about this. This will just come out, just brush out properly and. And so we were at a complete loss, we didn't know what to do. And then someone recommended you. I think you all came to Dubai Center for Special Needs. You all used to.
That's right, yeah.
And that's where I met you. And then, you said, no, this is tartar and it has to be removed. And she also has cavities.
Yeah.
And it will have to be done under GA.
Yes, that's
and
was one
giving
time.
GA to Zara is not the best because of her seizures.
Right.
And, we were really heartbroken that we had to put her through all this just because no dentist was willing to give the time. But you did. And, there are not many people like you, honestly. And you made sure that her teeth were back and, her gums were good, in good health. You taught us how to brush her teeth because it is a task. It is difficult.
It is a task, yes.
And, and ever since that day, we vowed that we would never put her through something like this again.
Yeah, I mean, because we witnessed it together, how difficult it was, not only for you, but as a professional, for me to witness her going through GA. And remember, I told you after that, you know what, this is the last time we are seeing her under GA. We are not going to get to this. We will maintain so that we don't have to treat. And you
and
guys
that's
kept
the
it up.
commitment. That's why we keep going and we keep coming to you. And we haven't found anyone who would want to, you have so much patience with her. She gags. I know that, we have to stop in the middle of treatment like 100 times. And you just say, it's fine, we'll give her more time and we'll just do it. And you give us 2 appointments instead of 1. You charge for 1, but thank you.
No, but this is important because I feel that, if we are not empathetic, then what are we doing? Basically, we are losing ourselves. So we need to connect back to where we belong to, each one of us. So that's the only thing. It's nothing big or beyond. It's just basic.
I wish all the people in the medical field would feel like that. There are very few people who are so dedicated and are so committed. Very few. Really.
I wish we will all multiply, and then likewise, like yourself, because some people they have the opportunity, but probably they keep it to themselves. But it's okay. Like I mean, I feel that the more we share information, the more it will reach out to people. That's the whole purpose of doing these podcasts. That those who are not able to access the books, those who don't have the time or life doesn't permit them the spare times, maybe they can hear our stories, and maybe they will believe more in the goodness. So that is important. If you could be remembered for one thing, what do you think it would be?
I would love that people would say that you've been a blessing in my life. I would like to
So
be
sweet.
remembered. I try every day. I have a lot on my plate, but if a parent calls me at any given time, I will talk to them. I will help them to go through the 7 stages of grieving. I had a parent calling me yesterday. I all the way from Bardubai till I reached home, which is a 45-minute drive. I was just speaking to her, and she said my son is mildly autistic. So I said, is your son verbal? So she said no. So I said, you have to come to terms with it.
Yeah.
That he's on the severe side of
Yes, if he's
autism.
not.
It's not just mild. And she broke down, she cried, and I let her, because this
Yeah.
was the first time. She said, do you think I'm still in denial? I said, yeah, you are, and it's fine. We all have been there. And I think I helped her to connect with her own child.
Absolutely,
and
yes.
and I would love that people would remember me by saying that I was a blessing in their life.
That's very sweet. The way when you said this 7 stages of grieving, I can't remember the author's name right now, but there's a book written, Seven Choices, that was also about the same thing. When people have when they reach a roundabout in life, sometimes the best human reaction is fight or flight. So the first one is always flight.
Exactly.
And we go into denials. And then if you do not have the people to guide you or show you that, you know what, the red flag is there, we better see it, then skip it. We won't be able to find a route around it, so see it. What's the best compliment you've gotten?
So
I can give you a lot of them, but
this
which
this
one?
story, this is true. This really happened. So he was a doctor in the UAE. He had a son with on the autism spectrum, but very, very, very severe. He used to scream, yell, bite, hit anyone that was walking around. And it was really hard to control this child. And that was the first time that this family came to the support group. Now, I didn't know them. And I just went up to him and I saw him, trying to make his son sit. And I said, this is one place where you can just let him be. If he wants to
Right.
run, just let him run. And it's safe. We are in an enclosed environment. It doesn't matter. Everybody will understand him. So please just let him be. And I said, are you really enjoying this child? Because you need to enjoy yourself,
Yeah.
You need to enjoy yourself and you need to enjoy your child. And, with tears in his eyes, he gave me a hug and he said, no one has said this to me before. And then many, many, many years later, he said, he said, that day when you met me, I was going to drive into a truck with my family because I could not take this life anymore. And he said, when you just said, why aren't you enjoying your son? He said, it just made me feel like, what am I doing with my life? And why am I even getting these thoughts? And he said, you were the one who saved me from just doing something so drastic and so stupid.
Wow. In neurolinguistic programming, like when you say this, I go back to one of my classes in neurolinguistic programming where we were talking about compliments, the power of words. Sometimes we may see a stranger and we just feel that maybe it's not important to say anything, but we don't know that stranger is carrying a baggage on them. And I think that's what you did. You were a blessing to him that day. Otherwise, maybe this family, this life, maybe they wouldn't have seen the next day. So
And he said, you touched my life in such a
Absolutely.
profound way. And now the whole family is moved to the UK. And he said, I'm so glad that we're still a whole unit and we're not, what he was planning to do.
Wow. That's really heartwarming, and I guess that's what keeps you as a drive as well. That you still continue, and you're continuing in a bigger and bigger way every day. Um, what has been your favorite job held?
I think, all of us as parents, I think that's our first big job.
Yeah,
To
parenting.
parenting is
Yeah,
a big job, and I have been so fortunate to parent two wonderful girls, different in different ways. Janai is just amazing. I've learned so much from her.
right.
Zara is amazing, and I've learned so much from her. So, but I think after being a parent, the my job as a teacher has been amazing. It's as an art mentor. And I started working only at the age of 46. Before that, I was volunteering. So my
Wow.
mother used to keep telling me, you're successful only when you get a job and when you're financially independent.
Right.
That's when you are, that's a job. This volunteering is not a job.
Right.
So when I was offered a job at the age of 46, I said, I can't come in as a volunteer just because of my mom. I need to get paid.
Yes.
So
Yeah.
that's the first job I held at the age of 46, and I love it. I'm close to 60 now, and I'm really not looking forward to retirement because I don't think I can ever retire from this job.
I guess, correct me if I'm wrong, that I think teaching is something that is inherent. It's like motherhood, it's like fatherhood, or being a teacher, because you can get a certificate, but you cannot get the compassion. You cannot get the empathy. These are the values that you have within you. So once you have, then you don't retire from your values. So they are going to be with you no matter where you are. But when you said that you got your first job at 46, it reminds me always of the thing that that when we connect the dots, as Steve Jobs always said during his lifetime, that wherever you are in life, go back and connect the dots. It does not matter which year, when. It only matters what you have done, because the
Exactly.
length of your life is not so important. It's the intensity. It's what you will actually leave behind you. So keep connecting the dots, and I think you've done it so
And that's
wonderfully
what I
well.
tell everybody. They ask me, what do you do in life? I really literally connect dots. I connect this parent with this parent because they need to talk
Yeah.
and, they need to learn from
To
one
hear from
another.
each
Yeah.
other, yes.
And that's what I've been doing for a long time. I do connect dots.
Literally, yes. If you could go back, I'm sure that you also believe that each day, if we look back, we'll say that, okay, maybe if it was today, maybe I would have decided this thing a little bit more better. Maybe I would have been more wiser. If you were to go back to your 18-year-old self, what do you think you would tell that 18-year-old girl?
That life is going to be up and down.
Right.
If it's straight, means you're dead.
Of course,
So
ECG. Yeah.
allow yourself to go down. And when you're down, it's fine because the only way out of being down is going up. So when you're
Absolutely.
up, it's scary because then you're coming down again. So allow that's going to happen. It's bound to happen. And in life, you'll only have two choices. Either you are miserable with your life, or you're
Right.
going to make a difference and you're going to be happy. So you have to choose every single day. Today, do I want to be? I wake up in the morning and say, today is a good day, I'm going to be really happy. And I wake up like that. Even though Zara's had a seizure in the night and the night has been completely messed up for us. 3 hours we've been awake with her. But I still wake up saying, today is a good day. Today is going to be a nice day and I'm going to enjoy myself.
Your biggest pet peeve?
It's people not understanding people with special needs, and feeling pity and sorry and, they've apologized to me. I said, why are you apologizing? They say, oh, sorry, your child is like this. I said, no, there's no need to feel sorry, We have a different lifestyle,
Yes.
but it's not a bad thing. It's not something bad that has happened in our life. It's something that we all need
Manageable.
to, yeah.
Yes.
And
Yeah.
it's how you live your life. And the stairs that we have, that really bothers me. Not so much for Zara because Zara is not bothered by the stairs, But the other kids who are, or the families who are in the mall trying to enjoy themselves, and then you sit and you just stare at them and you whisper and you make fun. If someone is a little person, then you laugh at them. I think that has to stop. It really has to stop. And they keep saying, we don't know how to react. We don't know how, but come on, find out. Internet is available.
Yes.
Stop your children from laughing or staring and pointing and then you moving your child away like our child has some contagious disease that we are going to give to your child.
No, you're very right that it's information that will change the environment. So more we talk about it, and when we were talking before we started to record that, you said that there could be a higher incidence of children born with autism.
1 in every 50.
So that's really high. That means the knowledge and the information has to be out and about, because it's not only about you and I understanding, it's about everyone around us understanding and accepting.
Exactly.
And accepting with grace, not with mercy, not with sympathy, because that's not what anybody
wants. We don't
wants.
want that.
Nobody, that's very correct. So when we talk about all this information out there, what do you think our world would look like in 50 years? If, let's say, we are able to, or when we are able to picture this in the wider world and more people become aware, do you think we are getting any better?
More and more children are being born with autism, 1 in 50.
Yes.
The numbers are really increasing. I don't know what it is. Is it the environment? Is it the food? Is it genetic? Nobody knows. So I feel in 50 years there'll be more people on the autism spectrum who will make the world a better place.
Because they will have so much to teach the people, like resilience, patience.
And unconditional love.
Absolutely.
And they don't judge. They say what is on their mind. And if every human being becomes and gets these kind of traits in them, I think the world would be a much better place.
It's very nice way of putting it. Very beautiful. So, most important lesson that you would like to be known for or that you have learned? And that's my final question.
I think resilience from Zara. That's the biggest lesson I've learned.
That no matter what happens, you just stay put.
For me, for everybody, and I didn't even know this word resilience. I got to know it only after Zara came in my life. And I think just go on. Life goes on. You can't stop.
You can't stop. That's right. Very nice talking to you, Gulshan. And it's such a nice message for everyone who is going to listen to this, that we need to grow. We need to stay put, we need to be resilient, and we need to be informative. We need people to accept and not just be sympathetic, rather empathetic.
Exactly.
So I'm sure our listeners are going to benefit from this. Thank you so much for your time, and thank you so much for sharing your story.
Thank you so much again for having me.
Thank you. Thank you, everyone, for listening to our podcast and the meaningful conversation with Mrs. Gulshan Kavarana. I'm trusting that the message that she said so strongly about resilience goes with each one of us, and we are able to apply it in our daily lives. Thank you.